Good afternoon. My name is Jeanine. I'm a counselor with the Employee Assistance Program here at Ascension, and this is a presentation on reasonable suspicion. So, reasonable suspicion, we're going to define it. We're going to look at what are some of the indications that someone is under the influence of drugs or alcohol, what your role is as a supervisor, manager, or other leader, and then kind of look at that whole process. So, all companies today, by and large, are drug-free workplaces. And by having that policy, it sends a message to employees that, there's not an allowance for coming to work intoxicated or under the influence of some other drug, which then protects your clients, or customers, and protects the employee and other employees. It also encourages people that may have some type of substance abuse problem to get help, and it complies with the Drug-Free Workplace Act of 1997. So, as leaders, you should be familiar with your employee handbook as far as what your policy is when confronted with an employee that appears to be under the influence. So it'd be a good idea to look at that policy as a refresher, and also think about what would you do with your employees that work remotely. So I know Foreign has quite a few employees in customer service, IT that may work remotely. So how would you address that with someone that's not on site? So reasonable suspicion is about just what it sounds like, reasonable suspicion. You don't have to be certain that someone is under the influence of drugs or alcohol to test. You test when employees are exhibiting signs, and there should be really two people present. You have an observation checklist, and two people at leadership level should be observing the employee to see if they can check at least two of the observable signs. It's not a good idea to rely on any secondhand information. So, not something where somebody posted something on Facebook or another employee said, oh, so-and-so was wasted last night, and none of that. It really should be objective and observable. And by going through that checklist, you have done your due diligence. So about 10% of all workers have some type of a substance abuse problem. So we're not even getting into just like the recreational use of drugs and alcohol. About a tenth literally have, if they want to quit, they're having a really hard time quitting. And 65% of all accidents on the job are related to drug and alcohol usage. And that puts the employee at risk, the other employees at risk, especially if they're doing something that requires operating machinery, or in the case there, maybe screen printing, embroidery. You can kind of imagine some of the things that could happen if someone is under the influence. So reasonable suspicion is important as leaders to look at. So people that are abusing substances, one of the telltale signs is, oftentimes they call in last minute or they show up late to work, but they are usually 25 to 30% less productive. And the whole issue of drug use in the workplace costs businesses over $100 billion a year. So it is a big problem and seems to be getting worse. To be candid, as a counselor, I'm seeing more and more people after COVID that really are struggling with drug and alcohol usage, drug or drug and alcohol usage. So as a supervisor, it's your responsibility to maintain a safe, secure, productive environment for employees. And of course, to evaluate performance with employees. Treat everyone fairly and act in a respectful manner that doesn't demean or label people. So it's not your responsibility to, diagnose a drug or alcohol problem, or to counsel the employee, or even to, take, a punitive approach. And we'll get into this in a little bit, so you kind of understand what I'm talking about. So when suspecting that an employee is under the influence of something drug or alcohol related, really the best practice is for two people, supervisor above, to use the reasonable suspicion checklist and to go through it and to kind of have an agreement that it warrants drug testing. If HR is available, to have HR present is always a good idea. I do recognize that some employees are working, different shifts after business hours where perhaps HR is not on site. Certainly calling, if you have a general 800 number of an HR call center or something, but at the minimum, two leaders should be involved in doing this checklist. And basically, if, the employee is suspected to be under the influence, they'll be sent to be drug tested. I don't believe 4imprint does it on site. Rather, they're sent to a drug test center. And so they will be, the center will conduct a 5-panel drug test. And by that, they'll be looking for cannabinoids, which is anything related to the hemp plant marijuana, cocaine, amphetamines, which include things like stimulants, methamphetamines, but also things like Ritalin and Adderall can show up on this test. Opiates and everything from, Vicodin and other painkillers to heroin and fentanyl. That's all in the same family. And then, of course, the other one would be hallucinogens. Will be tested for that as well. Things like LSD, PCP, mushrooms, that type of thing. So I thought this was kind of interesting, the drug detection times. So we know, depending on the size and weight of the individual, right? Like the smaller, the tinier, the slower the metabolism of the alcohol. But by and large, you can metabolize 1 drink an hour. And so if someone had been drinking heavily the night before, pretty much by the time that they get to work the next day, alcohol should be out of their system, unless it was really a binge drinking type of thing, where it is possible, to still be intoxicated even the next morning and going to work, right? Marijuana, this is the one drug out of all of them that crosses the blood-brain barrier. And probably because of that, it can really stay in a person's system for 15 to 120 days. So I think this is a tough one, right? Marijuana in particular, because here we are in Wisconsin where most marijuana is illegal. Yes, we have Delta 8, 9, and 10. You have dispensaries that are here. But the real, active part of marijuana is illegal in Wisconsin, yet it's legal right over the border in Michigan. It's legal right over the border in Illinois. So some people have treated marijuana as they would alcohol, um, as long as they're not, um, high at the time of working. Um, by and large, it's okay. Now, I'm hoping that doesn't um, bias you towards testing, and here's why. Some people will say, well, if marijuana stays in your system 15 to 120 days, and in that range, it's commonly like 30 to 45, right? That's kind of where we see it. What if this person used at a concert, 3 or 4 weeks ago, and they're acting a little weird at work because they're tired or they have a medical issue, and we have reasonable suspicion, we send them out for drug testing, and it comes back positive for marijuana, then what, right? So the interesting thing is that in these drug tests, it's not a yes or no, right? Levels of the drug can be tested, right? So the lab will kind of be able to know about levels and things like that. So I wouldn't let that dissuade you from testing. Cocaine takes about 1 to 3 days to get out of the system. Amphetamines, which includes, the methamphetamine, but also Adderall, Ritalin, anything that's like a stimulant, even prescribed stimulants for things like attention deficit hyperactivity disorder, those will test positive on a drug test. Opiates take 5 to 7 days, and other hallucinogens take 1 to 5 days. So what if, just throwing it out there, you have an employee that is prescribed Ritalin or Adderall? You don't know that, but they test positive because of that. They're taking it as prescribed. Well, that will all get washed out after their drug test, where a doctor can, a client can sign a release and show that, yes, this person is diagnosed and is taking this drug as prescribed. Or maybe there's an employee that's on painkillers for some type of injury of some sort where they have pain or chronic pain. And they may be on some type of opiate medication, right? But again, even if that shows up positive at the lab, there can be a backstory to that. It's not like the test is positive, so that's the end of the story. There could be a reasonable explanation for that. Having said that, it's still important to know if someone is acting kind of, loopy or falling asleep at work or not making sense or, acting like they're under the influence while at work, because even if, it's something that's prescribed, like a painkiller, for example, maybe a job working with heavy machinery is not ideal for someone who has a chronic pain issue where they have to take, heavier doses of narcotics to really deal with the pain. This is not like grounds for termination or anything like that. What I'm getting at is there might be another position that puts the employee and other employees less at risk, and therefore the company less at risk. So just something to consider. So what are some of the signs of alcohol use? I think since we live in the binge drinking state of Wisconsin, most of us know what that looks like. You can smell it. You know what people kind of act like when they're under the influence. Now, having said that, you can smell it. Sometimes if someone's really had a heavy night of drinking, you may be able to, even smell alcohol coming out of their pores or on their breath or whatnot. It's really not up to you to know, when they last had their drink, right? Were they drinking at work? Were they drinking the morning of work? Was it last night? That type of thing. Um, when they get drug tested, the lab will know what their blood alcohol level is. So when does alcohol use become alcohol addiction? Well, a lot of people start out, drinking socially, and then maybe it gets to, wow, I had a kind of crazy night. I don't remember things. I kind of overdrank, and um, I'm hungover, and then maybe some blacking out, and then maybe starting to crave drinking more and drinking more and more. There's kind of a progression of the disease, and so where we know it's really become an issue is when it starts interfering with home life, the family, when it interferes with work, um, when they lose interest in other hobbies and things like that. So it becomes, very unmanageable. We do believe, though, that addiction is a primary disease, and we know that with, technology and better brain imagery and all of that. We know that addiction is a primary disease, which means it needs nothing else to stand on its own, right? It's not like, well, I drink because I'm depressed, or I drink because I'm anxious, right? That person may very well struggle with depression or anxiety, but that doesn't cause addiction, right? You could have 100 people that drink heavily, and maybe 10 or 15 of those people become alcoholics, right? So is it, when you think about it that way, since, a lot of people drink socially, is it really, the addict's fault if they become addicted to alcohol? We can kind of almost look at addiction as we would any other disease. So it's not really a punitive thing, but it's just kind of, how addiction takes over. So how do they take over? Well, they the drug kind of gets involved in the reward circuit in the brain. So with some of these drugs, initially they're used for that feel good sensation or numbing out or things like that. And after some time, it's not using to feel good, it's using to not feel sick, right? The body starts to develop a dependence, right? And gets used to the drug. And then when withdrawing from it, there can be some pretty uncomfortable symptoms. Addiction also lives in the most primitive part of our brain. We call it the lizard brain or the reptilian brain, but basically the part of the brain that formed first and formed before all of this, which we call the prefrontal cortex. Now, the prefrontal cortex is responsible for things like, executive functioning, so time management, organization, learning, and all of that. And if you think about it, the reptilian brain is all about survival. So it's our fight or flight mechanism, right? So addiction really sends that fight or flight into overdrive. So when people are not using, that are used to using and have an addiction, some symptoms are, you may see them really, really anxious. They might be, a little shaky. They might be wringing their hands a lot, sweating, but they get anxious and stressed without using. Now, we do know that there are some medical conditions that mimic alcohol misuse. So certainly, if someone has seizures like epilepsy, right? If someone is diabetic, when your blood sugars are really low or too high, people can either pass out or, they can even go into a diabetic coma. Trauma, some difficult mental health issues, brain disease, neurological conditions like Parkinson's disease. And then even allergic reactions to prescriptions can mimic alcohol misuse. Again, that's why as a leader, you're not the one to diagnose, right? You just are there to um, notice that some of the symptoms checklists are occurring and it's affecting the way the person is behaving at work. So we kind of know this stuff. So marijuana being, a downer, um, they might have red eyes, slowed speech, kind of a um, no care attitude, um, tired, unmotivated, paranoid, distorted time type of perception. So um, these are some of the things you see, but you also may smell kind of that skunky odor if it stays on their clothes or in their hair, for example. So, again, I started to allude to this earlier, but is smoking really a big deal? Smoking marijuana, that is, really a big deal when many states are making it legal. So that's something for you to decide. But, um, you know, I think it is a big deal when it comes to being under the influence at work, right? Even if people are, you know, smoking marijuana illegally, right, behind closed doors. Um, if they're doing it before they come to work, um, and they're kind of, high, that really can create a lot of risk for that employee, other employees around, and the company as a whole. So some signs of cocaine use are things like being very energetic and alert, um, being defensive, aggressive. There could be wide mood swings, dilated pupils, restlessness. So it's an upper. So if you think about someone who's really keyed up, they might be pacing and appear to be very, very anxious. Those can be signs of cocaine use. Amphetamines. Um, so, yes, some of the ADHD medications fall in here, but so does, you know, crystal meth and ecstasy and Molly and all of that. Um, so these are the uppers. And again, really agitated. For some of these drugs, they can even cause some temporary psychosis, right? Where, someone thinks there's something on their skin and they keep picking at it or itching. So, yeah, so methamphetamines lately have become much more prevalent. So here's some of the symptoms, agitated, mood swings, sweating, confusion, talkativeness, and then that feeling of bugs on their skin. Contrast that with opiates, which is not an upper but a downer. So here we're seeing the opposite, right? More like sluggishness. It may seem depressed or apathetic, difficulty focusing, um, feeling nauseous, tired, those types of things. So we know that there's a serious problem with opiates in the US. Some of this happened, because of the over prescribing of painkillers for minor injuries, right? Where someone takes something and before they know it, they're addicted and need either a higher and higher level of the same drug or a stronger drug. So there's kind of a progression where people go from Vicodin to oxycodone, and then maybe they get cut off of the pain meds by their doctor. And so they're looking for it on the street and they, start using something stronger like heroin, and even fentanyl. Now, fentanyl is a very, pardon me, a very dangerous drug because you only need something that is roughly the size of the tip of my pen to be lethal. So something that tiny can be lethal. And oftentimes other drugs, other illegal drugs are laced with fentanyl for the purposes of, I don't know, getting getting people more addicted. But certainly there's been many fatalities because someone is taking something they believe to be heroin or even, you know, cocaine or something like that. And the drug itself is laced with a small amount of fentanyl. Um, so the hallucinogens, PCP, angel dust, can cause euphoria and hallucinations, and these users can become violent and or suicidal. So, you've heard of people having, really bad trips, things like that. These are the hallucinogens. And I've heard less about PCP and angel dust, more about like using shrooms, using mushrooms has been more common. And again, some of the signs are kind of the same here: hallucinations, poor coordination, paranoia, aggression, sweating. So then the question becomes, what triggers reasonable suspicion? Well, there are some obvious indicators like someone slurring their words or um, falling asleep and they seem to be really out of it. Those are the obvious ones. The less obvious are their job performance starts to suffer, right? Whether it's attendance or whether it's not hitting certain benchmarks, right? They start to struggle at work. They may be argumentative and um, not get along with coworkers, right? And they get into conflicts. Um, Poor hygiene, right? Like they're not showering, they're coming to work with clothes that aren't clean or hair that's unkept, that type of stuff. Um, so there can be short-term indicators or long-term indicators. The short term is something recent and serious, and the long term is like they've developed this pattern of behavior over time where the addiction has started to take over, that type of thing. Um, this is someone who used meth from uh, the late 70s, looks like 79, um, through the 90s. And you can just see based on their facial appearance how much things have changed. A lot of the sinking in of the face, loss of teeth and things like that. So the facial structure isn't the same. So, yeah. So there is a definite difference between probable cause and reasonable suspicion. Reasonable suspicion is, I think this person may be under the influence, right? They may. Probable cause is, yeah, this person is very likely under the influence, right? So you don't have to have probable cause. You just need to be reasonably sure that you think this person is using. So it's a lesser criteria. It's not as hard to meet. So reasons to test are a person's physical appearance, their behavior, speech and motor skills. Um, Maybe they're not really aware or really conscious. So there's multiple reasons. And without having to remember all this on your checklist, there'll be things to look for and indicate whether they're present or not. So yeah, so every company has an observed behaviors form. I know you have one there. Decisions to test should never be based on, a Facebook post or what somebody's colleague says or a social event. It really should be what you yourself and another supervisor observe firsthand. So how does this process go? So first you would identify the employee. Maybe you heard a complaint from a customer or another employee. So you document that complaint objectively, just the facts. And then you want to take that person Well, first observe the person working and see if any of these um, checklist behaviors are in place. If there's enough information to where you feel testing is warranted, there's some reasonable suspicion, then you want to pull the person away from their colleagues, give them confidentiality, move them to a safe area, and let them know that, you know, they're going to be drug tested. Best practice is to notify HR, right? Get them on the phone if you need to. Um, and HR will typically want to be involved in that process. But even if HR is not present, another manager can be involved in this. There should always, though, be two observers. So both should use the observation checklist. This really helps, show objectivity. Like it's not just, the employee could say, "Oh, this manager didn't like me" or whatever. Well, there's two separate people making their own observations, and especially if they're observing some of the same indications. So you assess the situation and then you decide together, is there enough information to test? Do we agree? Does HR think we should test? And then meet with the employee. So again, confidentiality and privacy, really important. And then you want to decide who's going to meet with the employee. If HR is on site, HR will typically want to be involved in that meeting. So when confronting reasonable suspicion, you can explain to the employee what you've observed and that to rule out the possibility that they're using and that they may be in violation of the drug policy, the drug-free workplace. They're going to be sent for a drug and alcohol test, and then provide the employee with a copy of your drug-free workplace policy and what the company does if an employee is suspected of being under the influence. And then I've heard supervisors and managers say, "Well, what if that employee refuses to be tested?" And you can say that refusal may lead to termination, but that a positive test does not necessarily mean termination. So I do not know what foreign prince policy is per se with positive drug test. But certainly if someone has an issue with substance use and they're willing to comply with treatment and all of that, that's a much different story than someone who refuses to be tested, denies things, all of that. So expect denial. Denial is the one thing that is common for all people in the throes of addiction. They will, cry and make excuses or come up with a million reasons. And so sympathy, apologies, diversions, it's important to stay calm, be objective, and stick to your decision. So when the employee is going to be drug tested, since it's off-site, they will be transported there, likely, I don't know what your policy is, but a cab or something like that. Now, if the employee gets mad that you want a drug test and refuses the drug test and just wants to storm off and leave, it's not up to you to restrain them, but it is necessary to call the police. And here's why. If that person leaves and is involved in some kind of OWI or hits somebody on the road and kills them or is in an accident and dies, right? That could be serious liability. So providing the law enforcement officer with their license plate, their make and model of car, and just letting them know that employee is leaving work that and appears to be under the influence. So it's up to the police to handle it from there. So prior to the employee going to the testing facility, the leader is going to call that site, let them know, prepare for transportation. I'm not sure what your policy is on that. If you use a cab company or if there's some type of policy on how to transport. And I'm not even sure about the third one. Some companies will meet the employee at the facility. Some just arrange transportation to the facility and from the facility home for the employee. That's pretty common. And then the employee is on suspension until the results come back. It's not a disciplinary suspension, so they're typically suspended with pay pending the results of the drug test, because if it's negative, right, then we don't want to be punitive. Now, employees have a way of, being suspicious and nosy about a colleague that leaves early for the day. So it's important to be very vague, like something came up for the employee, they just need to go home today. Not to have to lie about it or engage in any of the rumor mill that may be going around. So knowing your workplace policy is really important. Many companies have what's called a last chance agreement, where they may, in fact, have a dirty drug test, and some companies will terminate. Other companies, if this is a good employee that they want to keep, will have a policy where they get referred to their EAP, and the EAP someone like me will do a drug and alcohol assessment and kind of work with the client and determine if a higher level of care is needed. For example, if they're in the throes of addiction, perhaps more intensive treatment is needed. Certainly we do get a lot of referrals from companies in that respect. So typically before the employee can go back to work, though, they would be retested. So, and the levels would show. So what if someone is, smoked marijuana the day of and it showed up and they were, you were suspicious, and then, it showed up in their system in a drug test, and then they have to retest and it shows negative before returning to work. Well, here's what happens. The marijuana test will show kind of the usage level, right? The amount of TSH in their system. And then if they go back and drug test a few days later or a week later before returning to work, it probably won't be out of their system, right? Because it can stay in there for up to 120 days. But what should change is the level. The level should drop quite a bit. And if that's not happening, then they're not going to pass that drug test. So it is okay to, it's a very uncomfortable thing to have reasonable suspicion and bring it to the attention of an employee, especially if this is someone, that, is a good worker and you've known, and that type of thing. It's okay to apologize for the inconvenience, but don't apologize for your decision to test, because that's protecting you, the company, other employees, and the employee, him or herself. So if they show up negative on the drug test, well, that's a good problem to have, right? There's some other explanation for their behavior. Maybe it's a behavioral health disorder, or maybe it's a medical condition, or maybe they were prescribed that drug by their doctor and they're having an adverse reaction to it. I'm just throwing out possibilities here. So if it's negative, that's a good problem to have. So it's human nature, like if someone that's a really good worker has, this reasonable suspicion because of their behavior, to maybe make some kind of assumption that they're on some type of medication that may be causing this, but don't even go there, because that information is protected by HIPAA, the Health Insurance Patient Portability and Accountability Act. And we don't, you don't want to be, accused of the ADA that you're, violating that. So also the ADA protects people from disability-related inquiries that are not necessary for the job. So again, I alluded to this earlier, but even if they have a prescription for something that's affecting their performance on the job, say pain management medication, and they're in a job that they're dealing with machinery, right? Questions should be asked about, well, this is a good worker, we want to keep them, for example, but is this the right job for them? If they're, I don't know, screen printing or something, and they're dozing off at work, that can be a liability issue. So prescriptions too should be, let's just say they test positive for opiates. They have been prescribed opiates, but they haven't been prescribed in the last couple of months, and they were just taking leftover medication. That can be an issue because the medication has to be current. It can't be like, well, when I had my wisdom tooth pulled, I was prescribed some opiates, and it's a year later, and now I'm taking them because my back hurts. That's a problem. Some people think that secondhand exposure would create a positive result. So, certainly at, music concerts, rock concerts, there may be a lot of marijuana usage in the crowd. The levels for that will never be high enough to show up as a positive test. Poppy seeds, which is the opiate plant, eating that will not create a positive result. And by immediate testing the employee when they're on site, it helps to not give them the time to use other remedies to flush their system. So people that are taking drug tests that are scheduled and they may have something in their system, they know about things like, flushing their system or taking some type of an herb to flush them out. And drug tests can actually pick up on whether their urine is really diluted. So we're not talking about, drinking 8 ounces of water. I'm sorry, 8-ounce glasses or 64 ounces a day, right? Not healthy amount of water, but rather it's so diluted that it's obvious that they're trying to pass a drug test. So here's some common supervisor errors. One is not following the policy. Just not doing what they're supposed to do, maybe not having a second person involved, that type of thing. Or using secondhand reports, like not doing their own due diligence, but relying on what somebody else has said. Allowing the employee to leave before the test is complete, like if an employee gets mad at being accused and just wants to take off. A confidentiality breach. This is where, other employees know what's going on because you didn't make enough effort to take that person away from that environment. And then avoiding testing altogether. This is an uncomfortable thing for many supervisors to do. So, some supervisors would rather just avoid it, right? Like, yeah, I might have a suspicion, but I don't know if it's enough to warrant testing, and I don't want to go through all that. It's very uncomfortable. So other reasons why supervisors are afraid to indicate reasonable suspicion is the fear of being wrong. What if the person comes back and the test is negative, or they were prescribed the drug that they tested positive for, or that maybe they'll be sued or have a grievance filed if they're in a union, or oftentimes the supervisor is afraid of confrontation, or they're embarrassed and uncomfortable. So there's a lot of reasons why supervisors ignore testing and ignore this whole reasonable suspicion process. So when it comes to all of this, when you're dealing with the employee, you do want to emphasize that you're only concerned with the employee and their work performance, and use documentation offer the EAP as a resource. And if you make a referral to us, I don't know if you guys do mandatory referrals. I don't think so. I haven't had one before from Foreign Print, but give us a heads up, call our intake number and, um, they'll get the employee scheduled. So I did want to address briefly like remote workers. What do you do if, um, you suspect that a remote worker is under the influence while working? So little different scenario. It's not like, you're gonna, um, I suppose if you really think they're under the influence, you could, you know, send transportation to pick them up and take them to a testing facility. But oftentimes in the real world, what happens is their job performance starts to slip, right? Like maybe they're late for work or they miss a lot of work, or maybe customers, they used to do a great job in customer service and now they've had some customer complaints, things like that. So typically, job performance is kind of how all this kind of comes to light, right? They start to not do what they're supposed to do when it comes to work. So these are some really important don'ts. Don't try to diagnose the problem, right? Like if this person has been really depressed lately or anxious or going through a rough patch, they're grieving the loss of a family member or something, don't try to diagnose the problem. Don't discuss alcohol or drug use with them, even if you have reasonable suspicion. You don't have to get into like how much have you had to drink and da 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 da. Don't be misled by sympathy tactics. So employees will cry or get offended or overly emotional or plead. So don't give in to that. Don't cover it up like I feel like this employee is under the influence and I'm going to let them know what I suspect and give them a chance and say if this happens again, you're going to be drug tested. That's kind of a cover up, right? Like if they've already shown up under the influence, go through the process. Don't make any threats or promises. Um, HR will be involved if for some reason, there's termination involved in the results of a test being positive. So don't talk about, any of that consequences type stuff. And don't negotiate. You know, as I said earlier, you can empathize with the fact that it's an inconvenience or they feel humiliated, but that doesn't mean that you waver from the decision to send them in for drug testing. So it should not change that decision. So reasonable suspicion is a term that means testing employees who may be under the influence of drugs or alcohol. There's many indicators. Be careful of accusing, right? Just keep it to the observable symptoms. And the role of a supervisor is to keep the work environment safe and productive for all employees. So this is an uncomfortable part of being a leader, but it's definitely a necessary part. And with, seems to be more levels of substance use and addiction, you know, it's probably just a matter of time before you run into someone who, you know, may be under the influence at work. Um, so definitely be familiar with, the employee handbook at your company and what your process is for getting the person to drug testing, like where is the lab that you use, and is it okay to send them in a cab or an Uber, or what is the policy there, right? And the whole you know suspension with pay, like those are some of the variables that are kind of laid out by HR. So always, even if HR is not on site or not available, at the time that this happens, make sure that you do double back and let HR know what's going on with this employee and that you get them involved in that process. So, all right. Well, it was great meeting with you all today. And certainly, we're here for employees. Use us as you need us for anything from, um, can refer employees to us if they're struggling with anything that is mental health related. Maybe they're struggling with anxiety or depression. um, Maybe they've had a loss in their family or a close friend has passed away and they're grieving. Maybe they're having uh, difficulty getting along with other coworkers, right? There's been some conflict at work and can work through some of that. Even things like their career, and if they're kind of not sure what they want to do and that kind of thing, we can help with that. Um, so the EAP is for the employee and anyone in the household. So um, it could be their college. They may have a college student who is away at college. We see those people too. They're not necessarily under the same roof, but they would be when they're home from college. So yeah. So thanks again for your time and have a great day.